It's important to know the pathways for glycogen synthesis and degradation so that you can appreciate disorders of glycogen metabolism. Now, what happens when we have a deficiency or a defect in some of these enzymes within the process? The glycogen storage diseases get introduced. These are caused by abnormal glycogen metabolism, which will cause damage by allowing glycogen to accumulate to toxic levels in cells. Now, there are 12 glycogen storage diseases types, but we'll review the 4 most commonly tested ones, because that's what we're here about. We're here about test points. Now, all 4 of these are going to be autosomal recessive enzyme disorders. Expect to see at least 2 or 3 questions on the USMLE regarding these glycogen storage diseases in general. So this will be a high yield section because you will see some question regarding these on test day. The type 1 glycogen storage disease, also known as von Gierke's disease, is caused by a deficiency of the enzyme glucose-6-phosphatase. Now, where do you see glucose-6-phosphatase? Well, taking a look at our big picture chart here, we see the enzyme down here. Remember, glucose-6-phosphatase is going to convert our glucose-6-phosphate into a free glucose molecule. So that free glucose molecule can then leave the cell, travel to other parts of the body, and be acting as energy to the rest of the body. Now, muscles don't need this enzyme since they're greedy, and they use all of that glucose breakdown from glycogen. It may be helpful to think of von Gierke's disease that affects mainly the liver, and to a lesser extent, partly the kidneys. Thinking back to glycogen formation, if we have a buildup of glucose-6-phosphate within the cell, what happens? Since glucose-6-phosphate activates glycogen synthase, if glucose-6-phosphate is allowed to accumulate, so if we have a glucose-6-phosphate accumulation, we're going to increase glycogen synthesis. So even more glycogen is going to be formed. Consequently, patients with von Gierke's disease have increased glycogen stores within the body and severe fasting hypoglycemia, since the glucose can't be dephosphorylated and therefore can't leave the liver. We can make glycogen just fine, and we can partially break it down into our glucose-6-phosphate, but the liver isn't able to fuel the rest of the body because we can't convert that glucose-6-phosphate into our free glucose. So you're going to see severe fasting hypoglycemia. Now, this also causes an increased blood lactate, which can lead to gout due to the increased urine pH, and it can also cause hepatomegaly or hepatosteatosis, which is known as fatty liver. Some other effects include renal failure, delayed puberty, and hepatic adenomas. So here's some symptoms that you may expect to see. Now, the treatment is going to include frequent snacks of glucose-containing foods to ward off the hypoglycemic states. Now, since the glycogen can't be broken down by the liver to compensate for the low blood sugar levels. Also, affected patients should avoid fructose and galactose. Type 2 glycogen storage disease, also known as Pompe disease, is caused by a deficiency in lysosomal alpha-1,4 glucosidase. So circled here, we see where it is. Now, this enzyme breaks down glycogen into glucose within the lysosome. So it's kind of our detour method. Now, this is a very serious disease that primarily affects the liver, the heart, and skeletal muscles. Remember that Pompe disease trashes the pump, meaning it mostly affects the heart, but it can also affect some organs as well. The main finding in Pompe disease is cardiomyopathy, along with other systemic findings. Remember, our pump, our heart, is going to be trashed. Now, if you suspect glycogen storage disease that focuses on the heart being affected, you need to have Pompe disease on your differential. The third type of glycogen storage disease is known as Cori's disease. It's caused by a deficiency of this debranching enzyme. Now, do you remember what the function of the debranching enzyme was? Remember, The deep branching enzyme is required to break down glycogen into glucose by cleaving the 1,6-alpha bonds seen at branch points, along with some alpha-1,4 bonds at limit dextrin point. This primarily affects liver and muscles and has findings similar to type 1, remember von Gierke's disease, but without the lactic acidosis. So again, these symptoms include hepatomegaly, hypoglycemia, and delayed growth. The hypoglycemia is milder in Cori's disease than it is in von Gierke's disease, and symptoms in general are going to be more benign. This is because Cori disease does not affect gluconeogenesis, which is impaired in von Gierke's disease, because remember that glucose was going to be trapped within the liver in the form of glucose 6-phosphate in von Gierke's disease. That was this enzyme. Here we just have deep branching enzyme not working as well. And that brings us to our fourth glycogen storage disease that's going to be important for the USMLE, and that's type 5. This is going to be McArdle's disease. It's caused by a deficiency of skeletal muscle glycogen phosphorylase, so skeletal muscle, also termed myophosphorylase. Consequently, this is the only one that affects skeletal muscle and not cardiac muscle. You'll see the increased glycogen in muscle and the inability to break it down. Now, how may a patient with McArdle's present? Since muscles can't get enough glucose from breaking down its stores of glycogen, this can cause muscle cramps, myoglobinuria, muscle weakness with myoglobinuria during strenuous exercise, and also arrhythmias due to electrolyte abnormalities. And how would you expect to see hypoglycemia in the bloodstream? Well, you wouldn't. Now, why is that? Why would you not expect to see hypoglycemia in the bloodstream? This is because McArdle's disease does not affect the liver. Remember, it's only the muscle in McArdle's disease, which breaks down glycogen stores into glucose, and since muscles are greedy, they're not going to release free glucose into the body anyway, so it's really not going to affect the liver's capacity to release free glucose into the bloodstream. Lysosomes are organelles whose main function is to break down unwanted molecules using a variety of different enzymes. The deficiency of one of these enzymes can cause a lysosomal storage disease. Now, this is going to result in the accumulation of a sphingolipid or a mucopolysaccharide in specific cell types. Here's an example of a sphingolipid and mucopolysaccharide molecule. The structure is not going to be important. However, there are many buzzwords that you will need to know for the lysosomal storage diseases. To make life a little easier, we have already seen one lysosomal enzyme disorder. Do you remember what the disease is called when you have lysosomal alpha-1,4 glucosidase missing? If you have that missing, hopefully you're thinking good old Pompe's disease. The lysosomal storage diseases in general are going to accumulate metabolic byproducts and mostly affect children, which are going to be often deadly at a young age. They are all going to be autosomal recessive -2. And these are going to include Fabry's disease and Hunter disease, which are both going to be X-linked recessive. You'll probably get a question on your step 1 that asks you to identify a specific disease, an inheritance pattern, a deficient enzyme, an accumulated substrate, or a clinical finding from one of these lysosomal storage diseases. So, to get these questions right, you should take some time to memorize these diseases. Pay particular attention to what distinguishes one from the other. And as usual, we've provided some good ways to help you remember these. Let's start off with the Sphingolipidosis, which include Fabry's disease, Gaucher's disease, Niemann-Pick, Tay-sachs, Fabry's disease, and metachromatic leukodystrophy disease. So let's go through each of these one at a time and talk about the more important points. Fabry's disease is a deficiency of alpha-galactosidase A. So notice our deficient enzyme here. This is going to lead to an accumulation of ceramide trihexoside. This is going to be one of our X-linked recessive. So what are the two X-linked recessive lysosomal disorders? Hopefully you're thinking Fabry's disease because I just told you, but also remember Hunter. That's actually the name of my dog, Hunter, but this is Hunter syndrome. It's going to be X-linked recessive. All of the other lysosomal disorders that we're going to cover are going to be autosomal recessive disorders. That's an important thing to remember. We've got a picture here. Fabry's disease can present with angiokeratomas, which are going to be a capillary disorder, as you can see here. Gaucher's disease is the most common lysosomal storage disorder. Now, since it's the most common, you can bet your tush that your chances of seeing this disease on test day are going to be pretty high. Now, for Gaucher's disease, what is our deficient enzyme? That's going to be the enzyme glucocerebrosidase, aka beta-glucosidase, and it's going to be defective or missing, which leads to an accumulation of glucocerebroside. Another important pearl for Gaucher's disease is how they look. So if we take a look at this cell, such as this one right here, we notice that there are lipid-filled macrophages that kind of look like crumpled tissue paper, as you can see down here in the picture. Just imagine a crumpled tissue paper appearance. You need to be prepared to see a picture similar to this for test day. Niemann-Pick disease is caused by a sphingomyelinase deficiency, which leads to sphingomyelin building up. What is a quick way to remember this? You need to use your finger to pick your nose. In Niemann-Pick disease, you'll see lipid-laden macrophages called foam cells. Also, if the question prompt says that on fundoscopic exam you see cherry red spots, Niemann-Pick disease should cross your mind. An excellent way to remember which diseases have a cherry red spot, like the one that you see here, are going to include Niemann-Pick disease and also Tay-sachs disease. Both of these are going to have hyphens. So if they say a cherry red spot, notice how there's a hyphen in cherry red spot. Niemann-Pick disease has a hyphen, and you'll also see Tay-sachs have a hyphen. So if you see cherry red spot, notice that you're going to be thinking of your hyphenated diseases, such as your Niemann-Pick and your Tay-sachs. Both of those will have a cherry red spot. So, as promised, let's take a look at Tay-sachs disease. It's going to present with cherry red spots as well. So that's one way to distinguish clinical findings. This is going to be a cherry red spot on the macula. Tay-sachs is going to be an extremely high-yield disease. So remember that GM2 ganglioside is going to build up due to a hexosaminidase A deficiency. Now, here we can see Tay-sachs lacks hexosaminidase A. So if you hear of a lysosome with an onion skin appearance, you need to start thinking of Tay-sachs disease as well. This is just a buzzword that you need to commit to memory. What are the other two lysosomal storage disorders of Sphingolipidosis? These are going to include Krabbe's disease and metachromatic leukodystrophy. These will result in the abnormal breakdown of sphingolipids. While these are less important, make sure you remember these for test day, because you may see them. The mucopolysaccharidoses can be classified into two different yet similar disorders. Hurler syndrome is due to alpha-L inuronidase deficiency, which is going to lead to the accumulation of heparin sulfate and dermatan sulfate. Hurler is going to be the more severe of the two mucopolysaccharidoses. So if you're ever diagnosed with this disease, you'll probably want to hurl. Symptoms are going to include corneal clouding. So as you can see here, they may also have gargoylism. So kind of like a gargoyle on a church, which is joint and movement restriction, and then also hepatosplenomegaly. Do you remember what the two X-linked recessive lysosomal storage disorders are? Most of them are, remember, autosomal recessive, as you can see here. However, we have two diseases that are X-linked recessive. That'll include my dog Hunter syndrome, and also it'll involve Fabry's disease. These will be the two that are going to be X-linked recessive. Now, Hunter's is kind of the milder form of Hurler syndrome without the corneal clouding, so you're not going to have that, but it is going to include more aggressive behavior here. Notice how the same products are going to accumulate in both polysaccharidoses, and that includes heparin sulfate and germatan sulfate. Reading through all of these from beginning to end will be a lot of reading, and it'll be a lot of going in one ear and out the other. Now, I try to recommend you memorize this in a methodical manner, such as making sure you're very comfortable with the first one before moving on, and then be sure to look back and to review the ones you've already learned after going through each subsequent one. So that way, by the time you get down here to Hunter syndrome, you'll be a pro on all these up here. Now, returning to these often and quiz yourself, because this will be important for test day. Make sure you know these because you don't want to miss an easy point. Now, to learn these clinical pearls, the clinical findings for the lysosomal storage diseases focus on distinguishing characteristics for each disease. For example, Fabry's disease is going to focus on angiokeratomas. Gaucher's disease for bone necrosis and necrosis of the femur there, and metachromatic dystrophy, you're going to have ataxia. For Niemann-Pick and Tay-sachs disease, they're both going to involve the cherry red spot. Remember the hyphen trick that I taught you. Hurler disease is going to be notable for corneal clouding, which is going to be different than Hunter syndrome, because we have no clouding here. So for Hunter syndrome, you're not going to have clouding. Hurler, you will. The disorders that cause hepatosplenomegaly include Gaucher's and Niemann-Pick diseases and Hurler syndrome. What three diseases should come to mind if you see Aschkenazi Jew in the question prompt when referring to lysosomal disorders? This term Aschkenazi Jew should clue you into Niemann-Pick disease. It should also include Tay-sachs disease, and then also to a lower extent Gaucher's disease as well. So remember, it's a big list, but try and pick apart what distinguishes each. The cherry red spots, the hepatosplenomegaly, the Aschkenazi Jew. If you see Aschkenazi Jew in the question prompt, it should clue you in to certain diseases. A patient is diagnosed with Gaucher's disease. What is the deficient enzyme? What is the accumulated substrate? And what is the inheritance pattern of Gaucher's disease? The missing enzyme is glucocerebrosidase, which causes glucocerebroside to accumulate. Gaucher's disease, along with other lysosomal storage diseases, minus Fabry and Hunter's, are going to be autosomal recessive. So remember, Fabry's disease and Hunter are going to be your X-linked recessive. Everything else is going to be autosomal recessive.